go.
That's great.
There we go. Right, thank you. I'm going to hand over to you to let you introduce yourself and what this is all about.
Yeah. So my name is Lena Johansson. I'm the clinical trial manager for the ATTENS Project, and my colleague Irim Eradin is the postdoc working at the University of Southampton for this project. So the ATTENS Project is ADHD trial of external trigeminal nerve stimulation, and the project's funded by the NIHR EME program and the MRC. So this is the team. So some of you may be familiar with Professor Samuele Cortese, who works at University of Southampton and also in the Solent NHS Trust. And then Iram and me, and then we got Joshua Hyde, and then also in London we got Dr. Natalie Brosilova and Dr. Aldi Conti, who may be helping out in Southampton as well. So why non-medication treatment for ADHD? So there are limitations with stimulant and non-stimulant medication. So 27% do not actually respond to drug treatments. And there's also side effects, stunt growth, reduced appetite, sleep disturbance, raised blood pressure. And also, if you've got any kind of comorbidities, such as cardiovascular or eating disorder, you can't use any of those medications. And also, teenagers can be quite reluctant to take their medication. So that's also a problem when they come into the adolescence years. And there's no good evidence for long-term use if you're using it for a very long time. And there seems to be also a preference from children and parents for non-medication treatments. And I think someone just mentioned that before, that, not having. So I think this is why it's very good. It would be good to have options, to have a non-drug treatment as an option. So Iram, I'm going to pass over the science bit to you.
Yeah. Okay, so basically I'm just gonna talk a little bit about how does ATNS device work. So it helps to regulate the brain areas linked to ADHD symptoms via the trigeminal nerve, and it's the thickest nerve in our body. And as you can see in here, so it has branches that terminates close to skin surface. So one bit is just above the eyebrows, and it goes down and it goes inside the brain through the brainstem here, as you can see. And it conveys sensory inputs from the skin, muscles, and joints of the head to extensive connections in the brainstem and cortex. So and it's a significant pathway to critical brain regions like anterior cingulate cortex and inferior and middle frontal gyra. And these are the critical brain regions associated with attention, mood, and self-control. And why it is important to us, because most of the ADHD children or ADHD people have some impairments in connection and functioning in those areas, which affects their executive functions. So what is executive function? It is a higher level of cognitive skills that you use to control and coordinate your other cognitive abilities or behavior. You can think of it as think about an airport. So there's an air traffic control. So the planes does not crash when they're landing, when they're departing. So it just safely manages the arrivals and departures on multiple aircrafts on multiple runways. So it actually helps us to filter distractions, prioritize tasks, and set and achieve goals and control impulses. And actually, this is the frontal bit, it just does the executive functioning. And with ADHD people, there's just small problems with that. So that's why they're just having problems with attention and self-control. So this device is just via those areas I talked about. It improves executive functions by stimulating those areas. Yeah.
Thank you.
Mhm.
So the ATTENS Project, we are looking to recruit 150 children and adolescents aged 8 to 18 with ADHD. And they're going to be using the device for 4 weeks while they're sleeping. And 50% will use the real device and 50% will get the sham device. They look identical. But the sham device is not activated. So basically we use a randomization system to allocate. So it's beyond, we don't decide who's going to get what. Is it people are just, it's like flipping a coin, you know, that's how it's decided. And we started recruitment in Southampton, but we've been recruiting in London since September, and we've had a lot of interest in the project so far, so that's been really, really good. So we're testing improvements before treatment and then immediately after treatment, and then we do a 6 months follow-up to just kind of check on how, whether any lasting effects of the treatment. And we're looking at ADHD symptoms and then other things like mind wandering, anxiety, depression and sleep. And we're doing cognitive performance on several computer tasks, looking at attention, self-control and timing. And we also look at the safety of the device. And then this is only in London, but we also have an option for people if they want to do a fMRI brain imaging scan, but that's only in London. So if anyone feel that they're okay with traveling up to London and would be particularly interested in that, then that could be happening as well. They could be seen up in London if they wanted to. So randomizing is like I just said, it's done by a computer, and it's a 50-50 chance that you get either treatment. But even if you get the sham, it's all about acceptability, because it's all being used to wearing the device while you're sleeping, having the patch on your forehead and all that. So it's about acceptability, whether you think it's a suitable treatment, the way, even though you get the sham, but it's all about how you feel about using the device. We use something called double blind, or sometimes it's called masking as well. That means that the researchers don't know, and you won't know what device you're allocated to, but you will be told after the last visit at 6 months. And that's very important, because otherwise you may, like, if you know already what you're getting, you might say, oh, this is really good, but actually it's not, you just think because you think you're getting the real, if you're getting the real treatment. And yeah, so the device, the sham, placebo, they look identical. You can't tell them apart. And actually I've got the device, but I realized, Iram, do you have a patch nearby? Because I realized I forgot to.
Unfortunately, I don't right now.
Okay, yeah, I just to show you what the device looks like. It looks like this, and it connects with 2 leads, and then it's got a patch on that it's connected to. But the devices look exactly identical. So what we are looking for people to take part in our trial. So I said about the age range already, and about the ADHD diagnosis. We are looking for people who don't have any additional diagnosis, but we are okay with if people have conduct oppositional defiant disorder, or mild anxiety, or mild depression, or dyspraxia and dyslexia. That's fine, but not any other, like autism or something, then unfortunately. And the reason for this is if we're trying to figure out whether it's effective for ADHD. If we get lots of other diagnoses as well, it may not show the same effect, but if it shows that it's effective in ADHD, then once that's confirmed, then we can try to branch out and look at if it's effective also if you have any other diagnosis. But this is the first step, so that would be any follow-up studies would look at different studies and so on, but initially we will only look at if you've got an ADHD diagnosis. We also want both parents and child to be able to speak English sufficient enough to be able to complete all the interviews and questionnaires, because we don't have the abilities and facilities to have interpreters for other languages and so on. In regarding medication, so we want people to never use drug treatments, or have used it in the past but not currently using any drug treatment. And we don't want people to use the atomoxetine or guanfacine, but it could be that if your consultant's happy for you to come off that medication for a few weeks while you're doing the trial, that would be fine as well, but you would need to discuss that with your consultant. And then if you are on stimulant medication, that would be fine, but we want people, you can still take part in the trial, but you need to use the stimulant medication for every single day, because some people, they use stimulant medication, only use it between maybe Monday to Friday, not on the weekends and so on. But we need, for the full weeks that you're using the device, you need to use the stimulant medication every day. And then no implants or any body-worn devices, and no neurological abnormalities such as epilepsy or anything like that, and not have had any traumatic brain injury. There's also dermatitis, which is an exclusion criteria if you've got any problems like that, because there's some people have had potentially a little reaction to the patch. I mean, it's a reaction that goes away, but if you already have a skin problems with your skin, it might be best not to participate. We don't want to aggravate it for a longer time, because if you're going to use it for 28 days, it might make it irritating the skin. So this is the device, and I just showed you. So it's got FDA approval in the States. Basically means that it's got the approval as a treatment in the US for children age, I think it's, I can't see now, but 7 to 12. And the device also had the CE mark for treatment of ADHD in the UK until August 2021. But the company didn't renew the CE mark, and that was more of a business decision, because they got a new model, an updated model that they are launching hopefully later on this year. So this device cannot currently be purchased in the UK. So the only way to try this device is to be part of the trial. So like I said, we started recruitment, and we are anticipating that recruitment will finish in December 2024. So we're hoping to recruit about 6 children per month. I'm saying per site there, but that's not, it's per month across the 2 sites. So what we're doing is, we're recruiting participants through, like you, parent support groups. We're also doing contacting with different CAMHS clinics in London, Southampton and Portsmouth area. We're also having advertisements, flyers, and we got social media through Facebook. We're not too active on Instagram and Twitter. Facebook has been our main one. We also have the possibility of recruiting through GP practices, but we haven't gone down that route so far, but that might be something that we will do later on. So in terms of what it involves to be part of the trial, so there's the first visit, or the eligibility assessments is actually multiple visits. So there's a screener check, and then there's an interview with parent, interview with child, and cognitive testing. And some of these, the interview with the child and cognitive testing is done face-to-face. The others can be done online. Then what we would call a baseline assessment, then you use a computer task using an eye tracker and questionnaires for both parent and child. And then during the testing session, they will be wearing a device. It's like a Fitbit, it's called Empatica, but it just be checking on movements and so on. And it will only be worn while at the research center. And then we'll be checking the height and weight and vital signs. and then also training to use the device will be given, and that is face-to-face assessment. Then between week 1 and 3 each week, there will be questionnaires for both parents and child, just kind of following up how's it going and checking on side effects and ADHD symptoms. Then 4 weeks later, from baseline, there will be a research visit again, and that's face-to-face, basically very similar to what's happening at the baseline assessment. And then at 6 months, there's another visit, which is 5 months after the week 4 assessment, and that's also face-to-face. And then between the baseline assessment and the week 4 assessment, that's when you wear the device during the night. In terms of time commitment, how much time commitment we're anticipating. So for the eligibility, we're anticipating for the child it would take about an hour and a half, and for parents, maybe 2.5 hours. And the baseline can take for the child 2 hours and 15 minutes, and then 55 minutes for the parents, but that can be taken at the same time. Then the weekly assessment between week 1 and 3 takes, well, 10 minutes for the child and 20 minutes for the parents, roughly. And then at week 4, this is slightly longer, or slightly longer than week 4. Sorry, that the baseline 2 hours and 25 minutes and just 1 hour for the parent. And then slightly less than 6 months. But this is, so each child is very different, as you know, and it all depends on how many breaks the child needs, and we want to give, you know, it's very hard to say precisely how long an assessment takes, because it just depends on what time of the day, if you need to have a break and go and have lunch or something like that, or if it's sufficient while having a 10 minutes break or stretch your legs or so on. So this is just rough estimates about how long it will take. In terms of incentives for taking part of this trial, so we pay a total of £350 if you go through with all the assessments. So we will be paid at different stages. So £50 once eligibility is completed, £50 once baseline is completed, and then at week 4 it's £200, and then at 6 months is £50. If you were to be interested in the fMRI up in London, but that means that all assessments have to be done in London, there could be an additional £100 because we pay £50 per scan as well. Parents will also be sent a report on clinical measures and IQ from the eligibility and baseline visits. And if you were to do the fMRI, you'll get a picture of your brain as well. We will also reimburse a reasonable travel cost. But we're, you know, if you live somewhere around the Southampton area, you know, we'll cover those travel costs, whether you travel, whether that's mileage or train or something like that. But we are not able, if you live slightly further away, that you will require a hotel room, we're not able to pay for any hotels or anything like that. This is our project contact details. And that was the end of my presentations. Does anyone have any questions to me? Or to Irem?
I'm not butting in. If anyone does have any questions, it's a lot to sort of take in, I think.
Yeah.
But feel free, if you don't want to speak, you're welcome to pop them into the chat box if you would prefer that.
Can I ask a question? So the dermatitis, so clarify what that would mean for me, and like, would it need to be on the face or would it be generally body?
Well, if it's because some people could have a reaction to the patch, and obviously we don't want people to have a red mark or something like that on the forehead. You know, it could sometimes be that there could be discoloring, for example. So it all depends on how how sensitive. If there are, if it is that your child has some skin conditions, what we could potentially do, if if you're interested, is that we could send you a patch for you to try, and for your child to just a patch and see how your child would react to that patch, whether because personally I'm quite sensitive to kind of plasters. Certain plasters give me a reaction, but this one doesn't. So it's very different, but that would be a way to test and see whether it would work for you.
Actually, yeah, that would be a really great idea, because it would also be whether they can, like, from a sensory point of view, whether they would tolerate having a patch. This is what is going to be involved for the next, and actually that would give them a good idea about whether they could tolerate, whether that would be something they'd consider. That might actually be a really nice solution to that, actually.
So we'll be happy to send you a patch, and then you can try it out, and see whether it would work.
Brilliant.
Yeah,
thank you.
Right, have we got any other questions?
Hi, it's Elizabeth. Can you hear me?
Yes. Yeah, go for it, Elizabeth.
Hi, I find this really fascinating, and I'm just curious as to, at the end of the test, of the assessment, what you do ongoing from that? Is there any support? Is there any feedback? Is there something we can use? What do you hope to achieve? And I mean that really nicely, because I'm just very curious.
Yeah. So, well, at the end of research projects takes a long time. So if I give you a rough estimate of so we're going to recruit until December 24. We are now kind of due to report on the study to the funder in first week, in the January 26th. This is how long it takes. That's when we have to review, because it takes a long time analyzing all the data. So, and then once we've submitted to the funder the initial report, they're going to review it. They're going to edit it and kind of wanting to have review it. So I can anticipate that maybe if it's published, it will be published maybe it might even take a year on from that. That's how long the process is to actually, to get, and we would, once it's published, we obviously like to report back and disseminate the findings to tell whether it's an effective treatment or not, because if it's an effective treatment, that's fantastic news, and that's something that can hopefully be given through as similar to drug treatment, then that could be another way of kind of another option for families.
Because there needs to be alternatives to the drug treatment.
But also, if it's not effective, then that's good, because it's quite expensive. So it's good not to waste people's money on, or NHS money to kind of for treatment that's not very effective. So that's either both ways.
Okay, great, thank you. I was just find it very interesting. We manage ADHD at home without drugs or medication. We manage it through sport and lifestyle, but at his age, it's very challenging. So I'm very interested in alternatives. So thank you.
Yeah, so this might be a good alternative for you to try out and see whether that's suitable for you. And also in terms of even if it comes to being randomized and being allocated a sham, it's still the kind of getting used to the sleep and kind of familiarize with the device and using it and being compliant and using it. So yeah.
Great, thank you very much.
You're welcome.
Right, does anyone else have any questions?
I think Laura got a question.
Oh, go for it, Laura. Sorry.
Yeah, because sorry, that's made me want to ask another question. So at the end of the trial, so if at the end of the 6 months they say, my child was to say, yeah, that really worked for me, and they turn around and say, congratulations, it wasn't the placebo, you had the real thing. At that point though, I assume at that point they wouldn't be allowed to continue to use the machine, because obviously it's only a research. Would it then be taken away?
Yeah, so what happens, so you use the device for 4 weeks, and then you return the device to us and we do more assessments. But if, for example, then after 6 months, when we can tell you what you used, and then if you had the real one and you thought that it was a very good treatment, for example, I think it would be too, let's say you joined the trial now, for example, it would be too early for us to actually have come up with it to establish whether it's an effective treatment or not. But hopefully by that stage, there will be a new product out on the market that will be CE marked, that could potentially be purchased if, you know, would potentially be available to be purchased.
Brilliant, thank you. That answers that question. Thank you.
That's great. It sounds so exciting. We have big fingers crossed that things are going to, you know, really show to make a difference, and it will help a lot of families. Is there anyone else with a question?
So I'm happy to send you the slides, Jill, and for you to pass on to anyone and so on. And at the end of our contact details. So please get in contact, email us, and we'll respond. We'll give you some more. Obviously, this was a brief, kind of a quick introduction, but we, you know, if you're interested, we'll send you the information sheet. So we got parents' information sheet, and then we got information sheets, different age appropriate information sheets. So depending on the age of your child, we'll send you age appropriate information sheets. And then Irem will follow up and kind of have a little initial talk to you and talk a bit more about studying to see whether you potentially would be eligible to participate. And yes, and I mean, once that is done, and like in Laura's case, if you want us to send a patch to try out, that's absolutely fine, so we can do that. So yeah.
Yeah, I think there's just one thing we need to reiterate. So, like, you know, but if you use a device, if it worked, that's brilliant. So when the device came to market, then you would know that it would work for you. And if it doesn't work, then you would know that when it comes to market, that this is not a treatment for you. So that's why it is really important for us to see, just, you know, it works for some people. Maybe it works for just most of the ADHD children, but not some of them, similar to the stimulant medication. That's why it is important to know, like, you know, if you can, like, you know, use it and just benefit it or not.
Yeah, absolutely. Okay, right, I'm going to stop recording now. Thank you.